Hello everyone. Today I'm going to present you a tutorial on topic clinical anatomy of the median nerve. This is the second part of this topic. The first part in which we have covered the origin, course and the branches of the median nerve has already been uploaded. So let's start. First is your injury at the carpal tunnel. So what is carpal tunnel? Carpal tunnel is basically a tunnel that is formed by your anterior concavity of your carpal bones and flexor retinaculum. We have already discussed flexor retinaculum in detail in a separate video. So what are the clinical characteristics of your injury at the carpal tunnel? It is caused by compression of your median nerve in the carpal tunnel, and it produces a clinical condition that is known as carpal tunnel syndrome, right? A syndrome, a condition by the same name, that is carpal tunnel syndrome, right? So it is caused by the compression of the median nerve. Here is your carpal tunnel, right? And median nerve passes from the carpal tunnel, and if there is any compression due to tenosynovitis of flexor tendons. What is tenosynovitis? It is inflammation of your fluid filled sheath that surrounds your flexor tendons, right? Or due to myxedema, it is deficiency of your thyroxine hormone, or it is a kind of advanced hypothyroidism. Then retention of fluid in pregnancy. So in some ladies in pregnancy, there can be swelling of your peripheries, that is your hands and feet, which can also lead to compression of the median nerve in the carpal tunnel. Then there can be fracture dislocation of your lunate bone, right? Or osteoarthritis of the wrist. Osteoarthritis is a type of arthritis that occurs when flexible tissue at the ends of your bones wears down, right? If there is a wear and tear in the ends of your bones. So in that kind, in the osteoarthritis of the wrist, there can also be compression of your median nerve. So these are the causes of your injury at the carpal tunnel. Now, what are the clinical features of your carpal tunnel syndrome? So first is your motor changes. There would be ape-like thumb deformity. It is due to loss of your opposition of the thumb because the muscles of your thenar eminence has been paralyzed, right? So there would be paralysis of your muscles of thenar eminence, which would cause ape-like thumb deformity, in which there would be loss of opposition of the thumb. Apart from that, there would be paralysis of first and second lumbrical. I hope you know what is thenar eminence. Thenar eminence is basically the group of muscles that is present in the palm at the base of your thumb. So these muscles get paralyzed in the carpal tunnel syndrome, which would cause loss of opposition of your thumb. If median nerve would be injured, then obviously there would be sensory loss over the skin that is supplied by your median nerve, that is your lateral 3.5 digits, including their nail beds. So there would be sensory loss over the lateral 3.5 digits, including their nail beds. Here you can see that the area over the thenar eminence, that is this area, there is no sensory loss over this area, right? It is because this area is supplied by this is the area of your thenar eminence. This area is supplied by palmar cutaneous branch of your median nerve, and it passes superficial to your flexor retinaculum. It means it is passing superficial to your carpal tunnel. Therefore, this area, that is your area over the thenar eminence, which is supplied by palmar cutaneous branch of median nerve, is not injured, and therefore there is no sensory loss over here, right? So what happens? The skin area with the sensory loss becomes warm and dry, right? Why warm? It is because of arteriolar dilatation. Arteriolar dilatation means widening of your arteries, and it also becomes dry. Why dry? It is because of your absence of sweating due to loss of your sympathetic supply. As there is loss of the sympathetic supply, so the area over the sensory loss would be dry, and it would be warm also because of your arteriolar dilatation. Then there are tropic changes. What happens there, that long standing cases of paralysis, it leads to dry and scaly skin, and as a result there is atrophy of your nails, right? The nail crack easily, and there is atrophy of your pulp of nails. Then it occur both in males and females between the age of 25 and 70, right? So these are the clinical features of your carpal tunnel syndrome. Feeling of burning pain like your pin and needle along your sensory distribution of the median nerve, right? This area, the area in the red, the area of the sensory loss. There is no sensory loss over your thenar eminence, as it is supplied by your palmar cutaneous branch of median nerve, which passes superficially to your carpal tunnel. There would be weakness of thenar muscles. There would be ape thumb deformity due to loss of your opposition of the thumb. And in carpal tunnel, the patient shows positive Tinel's sign and Phelan's test, right? Comes the injury at the wrist. So we studied that injury of the median nerve in the carpal tunnel would cause carpal tunnel syndrome, right? So now comes the injury at the wrist. So at the wrist there can be injury to your median nerve and its palmar cutaneous branch as well. We previously saw that in the carpal tunnel only the median nerve that passes deep to your flexor retinaculum is injured, and the palmar cutaneous branch of your median nerve, which is the superficial branch, is not injured. But when there is an injury at the wrist, it can be due to suicidal cuts or any wound or any cut injury. Due to that, there can be injury to your median nerve plus the palmar cutaneous branch, the superficial branch. So what are the clinical features? There would be ape-like thumb deformity, right? It is due to loss of your opposition of your thumb because of the paralysis of muscles of your thenar eminence, the muscles that is present in the palm at the base of your thumb, right? So paralysis of muscles of thenar eminence would cause ape-like thumb deformity. In this picture you can see that the thumb is rotated laterally. Then there is sensory loss over the area supplied by the median nerve. And here you can see that the area over your thenar eminence, the area over the muscles of thenar eminence is also, there is also sensory loss over the area of the thenar eminence because the palmar cutaneous branch is also injured, right? So there is sensory loss on the lateral part of your palm, including the area over the thenar eminence and lateral 3.5 digits, including their nail beds, right? Now comes the injury at the mid forearm. So if there is an injury to your median nerve at the forearm, it would result in pointing index finger. It is because of your paralysis of your flexor digitorum superficialis muscle. The radial head of flexor digitorum superficialis muscle results in pointing index finger. Plus the other signs and symptoms would be same when there is a lesion to your median nerve at the distal forearm or your wrist. So we previously studied the injury to your median nerve at the wrist. So the signs and symptoms would be same of your injury at the wrist, plus there would be pointing index finger, right? Pointing index finger because of your paralysis of your radial head of flexor digitorum superficialis muscle. Now we have injury at the elbow. So what are the causes of the injury at the elbow? They can be supracondylar fracture of the humerus, right? Then during venipuncture, there can be application of tight tourniquet, right? The tourniquet can be tight during the venipuncture. Then the median nerve passes between the two heads of your pronator teres. So there can be entrapment of your median nerve between the two heads of pronator teres, right? So now what are the clinical features of the injury of the median nerve at the elbow? The forearm would be in supine position. It means there is loss of pronation due to paralysis of your pronator teres muscle, right? There would be paralysis of pronator teres muscle, and as a result there is loss of pronation of forearm, and the forearm would be kept in the supine position. Then the wrist flexion would be weak. It is due to paralysis of your forearm flexors except medial half of flexor digitorum profundus and flexor carpi ulnaris, as these two muscles, the medial half of flexor digitorum profundus and flexor carpi ulnaris, these two muscles are not supplied by your median nerve. So these would be not paralyzed, and all the muscles of your flexors of your forearm would be paralyzed except these two. Then there would be adduction of the wrist. It is due to your paralysis of flexor carpi radialis. Then there would be no flexion possible at interphalangeal joints of index and middle finger. It means the index and middle finger would lie straight. There would be no flexion possible at IP joints of your index and middle finger. Then there would be benediction deformity. What is benediction deformity? In this deformity, when a patient tries to make fist, right, the index and middle finger remains straight. It is because of your paralysis of superficial and deep flexors of these fingers, right? So whenever the patient would try to make a fist, there would be no flexion at the interphalangeal joints of these fingers, the middle and index finger, and as a result there would be benediction deformity, because there would be paralysis of superficial and deep flexors of middle and index finger, right? Then there is loss of flexion of the terminal phalanx of the thumb, and it is due to paralysis of your flexor pollicis longus. So flexor pollicis longus muscle is paralyzed, and due to that there would be no flexion possible at the terminal phalanx of your thumb. Then there would be ape thumb deformity, right? We already know what is ape thumb deformity. Then there is loss of sensation in the lateral half of your palm and lateral 3.5 digits, including their nail beds, right? So there would be the sensory loss over the skin supplied by the median nerve, right? And there would be sensory loss over the area of your thenar eminence as well, because the palmar cutaneous branch is also injured, right? So these are the clinical features of your injury of the median nerve at the elbow, right? So this was all about the clinical anatomy of your median nerve. In this video, we have covered carpal tunnel syndrome, which is a very important topic. Then injury at your elbow, injury at your wrist and mid forearm, right? So injury at the elbow, injury in the carpal tunnel, which leads to carpal tunnel syndrome, injury at the mid forearm and injury at the wrist, right? So I hope everything is clear to all of you. If you have any doubts, let me know in the comment section below, and don't forget to like, share and subscribe. Thank you.